All right, wonderful. So we're recording. We're going to get that to the Student Affairs YouTube channel. But first, I'm going to turn it over to our Student Health Services experts. We've got Charles, Dr. Weddick, and Michelle, and then we have Dr. Greenwald and myself behind the scenes to answer any of your questions. But Charles, I'm going to turn the virtual stage over to you.
Thanks, Summer. Welcome, everyone. My name is Charles Guthrie. I'm the Executive Director of Student Health Services and happy to be here with you tonight and share all of the services we provide to your students. Dr. Weddick,
All
introduce
right.
yourself.
Yes, Dr. Weddick. I am the medical director as well as a practicing physician. I use she, her pronouns. I've been here for 20 years, so I have loads of experience with the student population, and I really enjoy providing care for them.
Michelle.
Michelle?
Hi there, my name is Michelle Cavone. I am the pharmacy manager at University Pharmacy, part of Student Health Services. I am a pharmacist and I've been with Pitt for 9 years now. Super excited to tell you all about our services.
Thanks. We're going to dive right in. Maybe. Again, dusting off our... There we go. Sharing the locations of where we are. We are in the heart of the campus. So Student Health Services comprises of the clinic, pharmacy, and our health ed and promotion team. The clinic and pharmacy are both located in Nuremberg Hall. Pharmacy is on the first floor on the corner, and the Student Health Service Clinic is on the second floor. And then health ed and promotion is located up in our new recreation and wellness building, and they're located on the 8th floor there. So as Student Health Services, we're committed to providing quality preventative healthcare for our students, along with health promotions and pharmacy, and I do not know why it's advancing in itself. I apologize. And we are here to serve the students to help them build a strong foundation for a healthy and well life.
Okay, so I'll hop in and just talk about our clinical services. One of the ways that I really like to describe student health services is we are your student's primary care provider away from home. So what that means is we do pretty much everything. We do acute and chronic conditions, meaning we can see your student for an upper respiratory infection, for a sprained ankle, as well as for management of their asthma or allergies if they're in a new setting and those are flaring for them. We do full gynecologic care, including cervical cancer screening, STI testing, all contraceptive options. We do LGBTQ care, as well as gender affirming care. We have sports medicine fellows who come in twice a week because students often do get injured in various ways, and they are very useful in helping us to appropriately manage. We have lab services. We work with Quest labs. So we have some point of care testing like a rapid strep, rapid mono, as well as we have a Cepheid machine that's able to do respiratory viral testing for like influenza, RSV, which is and COVID, very helpful during respiratory season. We have an observation unit where we can hang on to students for a little bit if they're feeling unwell, and we need to give them IV hydration or just keep an eye on them for a little bit. So we pretty much do everything. See, next slide, Charles. We also do allergy injections. We know a lot of students have been getting allergy injections from their home physician. So that's something that we can set up and see students as frequently as necessary to maintain their schedule. We do all sorts of immunizations, including flu shots annually, as well as COVID shots annually. We do routine physicals, driver's license physicals. We do both pre and post exposure prophylaxis. We do pre-travel assessments if somebody's going to be traveling abroad, just going over the medical history, immunizations, the area where they're going to ensure that they are up to date for everything that they need. We do all of the intrauterine devices as well as Nexplanon, which are both long-acting reversible contraceptive methods, both insertions as well as removals. We provide rapid HIV testing, and we do have psychiatric services. Next slide. These are our hours of operation. So we are there 6 days a week during the school year. We go into the evening hours on Mondays and Thursdays, daytime on Tuesdays, Wednesdays, and Fridays. During the summer, we do cut back a little bit. Okay. I guess next slide. So ways of making an appointment. We do have the ability for students to call and schedule, but I know students don't like to call. I think that's kind of seems to be the nature of it. So we do have the opportunity for students to self-schedule through our patient portal. We do in-person as well as telemedicine if that's appropriate for what the student wants to be seen for. We kind of have a model where we have our schedule is such that in the mornings we tend to have more future appointments. So for more sort of routine things, I want to get a physical. I want to, talk with somebody about my belly pain that's been going on for a while, but nothing urgent. Afternoon is more kind of same day, waking up, feeling unwell, needing to be seen more immediately. We discourage students from walking in just because it is challenging to end up with a whole slew of students there that need to be seen. But certainly we would not turn somebody away. Our front desk folks are great and would work with them. We also, if the front desk folks have any questions, they would loop in one of our nurses so that we'd make sure that the students are appropriately taken care of. Obviously, in terms of emergencies, call 911. Oakland is right in the purview of UPMC. So there are two large, excellent emergency rooms just within blocks of campus. Confidentiality, we abide by HIPAA, which now that the student is an adult, that means that when they come to see us, it's confidential. Now, I know sometimes parents get a little concerned about that, worried about what does that mean, confidential, how am I going to know what's happening for my student? The couple of things to keep in mind are that number one, generally in an emergency situation, that's often more like in the residence hall. So that's a whole different sort of model of how they would inform you. With us, generally speaking, if we are recommending that a student go to the emergency room, one of the things we're frequently doing is getting a parent on the phone because often that can be a little stressful for the student. We want to fully, inform the parents. So we're not trying to create any barriers, but by the same token, we're trying to encourage the students to start having some of their own autonomy and decision making over their health care. I'll turn it over to Michelle.
Thank you, Dr. Weddick. So as I said before, my name is Michelle Cavone. I'm the pharmacy manager at the University Pharmacy, and just want to talk to you a little bit about the services that we have. So we are located in the same building as Student Health. We are at Nordenberg Hall. We are directly at ground level. So we are at the corner of University Place and Fifth, directly across the street from some of the dorms. And because we are considered essentially a nonprofit pharmacy, our cash prices are generally lower or very competitive with your other community pharmacies. And so we really do try to offer the lowest prices that we can for the students, especially in with our over-the-counter items. We have an array of most of the over-the-counter items that you would find at any retail pharmacy. So we have cough and cold, allergy medications, pretty much anything that you would find elsewhere at competitive prices. We also do accept most insurance plans. There are a few that are specific to your home state. If you have any questions about your particular plan and if it can be used out of state, we definitely recommend calling your member services number and finding out if you are able to use your insurance out of state. We can be reached by phone. Your students can call us. We also have on our website, you can text us through digital services. We have an app called Nimble, which is brand new to us this year. So we have two-way texting, which is all HIPAA compliant. And we can only communicate with the students because of HIPAA, like Dr. Weddick had mentioned. We do refill reminders, just like you would see at any of your other home pharmacies. We operate the same way that any of your hometown community retail pharmacies do. We can do automatic refills. If your student has refills at their home pharmacy and they want to transfer them over to us, we can take care of that for them. You don't have to have a new prescription sent directly to the pharmacy. We can call your home pharmacy for you. On our website, which there is a link here, there is a form to fill out if you are a new patient and need a transfer. You'll enter in, actually, the patient, the student, will enter in all of their information, including the name of the pharmacy that they want us to call and the name of the medications that they need us to transfer. And then that comes over directly to us. If we have any questions, we can reach out via text message. Through that link and requesting transfers, you can upload your insurance information so we can get all of that entered into the system before your student even comes onto campus. We did want to mention that if your students are taking any controlled ADHD medications or any medication that's considered a controlled substance, those type of prescriptions cannot be transferred. You would need to talk to your home physician about getting those transferred over to us. And then I just mentioned briefly about our two-way HIPAA secure texting with the Nimble RX app. And also recently, as of today, when your student gets a text message that their medication is ready for pickup, there's also an option to check out online. If there's a copay, they can pay that copayment right online. If there's no charge or no copay, they can still check out and opt if they have any questions and they'd like to speak to the pharmacist. And that sort of speeds up the amount of time that they're in the pharmacy so we can get them healthy and back to class. Next slide.
Back to me. So our Office of Health Ed and Promotion, they offer a variety of programs and services to enhance community health and student well-being. We have wellness coaching through our Wellness Concierge program. This is a peer-to-peer led program where students work with trained students work with your student to set personal wellness goals and then help connect them to the multitude of resources in the university community to help them be successful. We have a registered dietitian on staff that is free for students to be able to utilize. She does counseling and helps students with healthy meal prep planning, diet issues, and working through a plethora of issues, which is really nice because most insurance plans don't cover a dietitian, so we do have that available for students. We have substance use prevention and education programs. We have peer-led Narcan training in partnership with the Allegheny County Health Department, where we distribute free Narcan to those students who go through that training. Also in our new Rec and Wellness building, we have a brand new stress-free zone that is also manned with peers who get educated on yoga, mindful meditation, sound bathing. We do offer lots and lots of different programming and We also coordinate with our University Counseling Center and our rec team to offer different programs such as Natural Connections, where they do mindful activities throughout the Oakland campus and trails in Frick Park, which is really wonderful. Panther Wells is the name of our peer-led educators. They do lots of workshops and events. Two big key events for us is in the fall, we have our wellness fair. And then in the spring, we have our self-care fair. And again, they're located in the new wellness suite in the new building. So we're going to transition into some important information that we collectively kind of came to after all of our years of experience to make sure that you all are aware of before move-in and before you come to campus. First and foremost, university immunization requirements. I'm sure you've received communication around these requirements. All students coming to the university are required to have MMR and varicella and enter those into the immunization portal. And if they are going to be living on campus, meningitis immunizations. Our team helps manage the compliance with that and monitoring. There is a separate website, separate email account that are in all of the email communications that you'll be receiving throughout the summer around immunization requirements. So please don't hesitate to reach out to that email if you have any questions around the immunization requirements. Also, a question that comes up a lot is around what does the recreation and wellness fee cover? For us at Student Health Services, it helps cover some of our some clinical services, such as the flu vaccines, rapid HIV testing, again, the dietitian visits, and then all of our health ed and promotion programming. That is all free to students. They don't have to pay for any of that programming. And always like to say this, it does not cover their health insurance or provide health insurance coverage for them. It provides access for our campus recreational building and all of their facilities and intramurals and club sports. Our care and resource team, which is another really wonderful wellness team, that when students are having some just general issues or need some additional supports, they're there to lock arms with the students to help them navigate some of the complications of academic rigor, potentially insurance needs, lots of different things that the care and resource team provide for the students. And then the University Counseling Center is available and free of charge to students because of the recreation and wellness fee. While we're talking, now going to transition into health insurance. Again, we will see students regardless of their insurance coverage. However, it's important to make sure that your student does have health insurance coverage, because their insurance coverage would dictate what they may be charged for the clinic visits, any laboratory tests that we may have to send out, imaging that we may have to request, their prescriptions, if they need to see a specialist, need to go to urgent care, or go to the hospital. Insurance helps reduce that financial burden and make sure that they are protected. So some things that we want to make sure that you do before you arrive is make sure that your insurance plan, if you are not getting the student health insurance plan provided through the university, that your insurance plan is accepted in the Pittsburgh area, that your student has access to in-network hospitals and specialists, that the prescriptions, like Michelle had talked about, are covered. Mental health services are covered locally as well in Pittsburgh, and that emergency and urgent care services are also covered. So some really granular things for you to do when calling your insurance company. So you're going to call your member services number that is on the back of your insurance card. And the questions that you need to be asking are, is my student covered while they're attending college in Pittsburgh? Are the providers at the University of Pittsburgh Student Health Services considered in-network or out-of-network? Because again, that will determine what your insurance copays and responsibilities will be determined. Our UPMC hospitals and physicians in network, or the other major health network in the area is Allegheny Health Network. Again, as Dr. Weddick spoke about the UPMC hospitals, there are two that are blocks from the campus, so they are the closest. What would my students' deductible, copay, and co-insurance be? Does my student need referrals or prior auths for any specialty care? Are telehealth services covered? And again, is the university pharmacy considered a preferred pharmacy? And make sure you write down the representative's name, date of the call, and the reference number from that interaction. And then just to close, some important numbers: our number to the clinic, to the pharmacy, and then also our main student SHS website that has all of our information on it. And then I don't have a question slide, so we're now at the Q&A part.
Excellent. We have questions coming in. Many have been answered. Thank you, Dr. Greenwald, for typing those answers in. But Charles or anyone on the call, the first question is there something that students can have on file that allows parents to receive medical information on their student if the student wants or allows them?
That is a great question. So in the state of Pennsylvania, there is not a blanket consent. While you could have a power of attorney in place in the state of Pennsylvania, a power of attorney only grants access to medical information when the student or the person designating the person that they want to have this power of attorney are incapacitated and are unable to make decisions on their own. That said, we do have a release of information form. So per incident, so your student comes in for a sprained ankle and they want you to be looped in and able for us to share that information, they would have to sign that release of information. And again, that'll be for that episode and that specific incident. Because if they come in the next day with a fever and diagnosed with the flu and didn't do the ROI release of information form, we would not be able to share that information. And that information is on our website as well.
Wonderful. Next question, to whom can we reach out to at Student Health Services for insurance coverage information?
So Student Health Services does not manage our student health insurance plan. That is with our HR team, and there is a website for it. I don't know it off the top of my head, but if you go to the Pitt main website, and maybe we can throw it in the Q&A.
I'm going to put it in the chat. Yes, I'll go find it.
Wonderful. Yes, and if you search student health insurance plan, it'll take you right to it, and there's links and phone numbers there to help manage that.
Well, I'll get that.
And the SHIP, so that we use that as an acronym, the Student Health Insurance Plan. We are in network. UPMC is in network. I don't know what the copays and all that stuff is, but and the pharmacy is in network. So all of the closest and most relevant healthcare providers are in network on that insurance plan.
This question is about billing. Any bills related to out-of-state student healthcare visits, labs, or results, do they go to the parent address or the student's residence hall or local address?
Oh, that's a great question. So we always tell students to update their address with the insurance provider so that they would get the EOB and the bills. The lab services we contract out to Quest, so they would bill directly, but anything that comes from us that would be co-insurance, deductible, and copay goes to the student account and the bursar account, and it will just say student health fee. And on the portal, we're able to have the bill there for them to see the details as well.
Sorry, I knew I'd get distracted trying to get the link for the student health insurance, which I am putting in the chat right now. Our next question, if a student is not feeling well and wants to see a healthcare provider outside of clinic hours, they should go to a hospital or to an emergency room, correct?
So that
Correct.
depends oh, sorry, guys, talk about it.
Well, I was just going to say the nice thing is that we do have a nurse line that kicks in when we are not in the office, so a student can call and talk it through with a nurse to figure out, is this something that is a true emergency? Do I need to go to the emergency room, or am I able to maybe wait? And so when our nurses come in first thing in the morning, they go through all of the calls. And if students, woke up with, a terrible sore throat, they'll call them and get them in that day. So we really try to not leave students without somebody that they can go to for advice. Advice other than ChatGPT.
Wonderful. So we've answered all of our live questions, but we have a good amount of time left on our webinar. So I am going to wait a minute or two to make sure if you're sorting through the great information that you just heard and something rises to the top for you, let's put it in the Q&A. We can get it answered quickly. We did have a question that I really enjoyed this as a fan of the show, but someone wants to know if they'll get to meet Dr. Robbie, right? Since the Pitt is based. Right?
Of course. Absolutely. He comes by all the time.
I love that. At first I was like, Dr. Robbie, who? I had to think about who was on the call, but then I realized yeah, there were definitely some fun references to Pittsburgh. Some of those. Next question in the Q&A, do you recommend to establish a primary care physician relationship right away when they get there, or should they wait until they need care?
I'm always happy to, or I mean, in my mind, if somebody wants to come in, especially if they have some medical concerns or issues, and even if it seems kind of stable, because often students are kind of doing that transition between like kind of, aging out of the pediatrician, but haven't fully settled into seeing, an adult doctor yet. I think it's great to be able to sort of establish with somebody, and then if they like them, that's great. If they don't mesh with them, we do have plenty of providers so that students can kind of pick and choose a little bit to find somebody who suits their personality. But yeah, I'd say either way. But if somebody's going to be there for 4 or more years, we're always really happy to establish a relationship with them.
Again, we're so efficient. We have all the questions answered. Oh, we got another one. Perfect. How can a student waive insurance offers to university if they have insurance through their parents?
That is a good question. So the University of Pittsburgh is not a hard waiver school, so we don't require insurance. Again, as I talked about earlier, we believe strongly that it is important to have health insurance and make sure that it's adequate coverage so you don't incur undue costs. So I would say weigh it between what your plan is and what the student health insurance plan provides, and see which covers the most and is most cost effective. Because if you're an out-of-state plan and they will, any of the networks are not in network and we won't be in network, then you're going to get all out of network charges. So in the end, it may be more expensive than just getting the student health insurance plan. So I would say look at both, but you don't have to waive the university insurance plan because we're not a hard waiver school.
Well, next, we've got a couple of questions rolling in. We'll get through them. The next one is, we have PCP insurance through this student's father. Do they need to change to a local physician as the PCP?
Again, I would call your insurance provider and have that discussion with them, because every plan is different and they will tell you exactly what you need to do to make sure that you get in-network services here at the university.
Next question is, can you expand a little on behavioral health services? Do you have therapy services? And I'd also like to point out that we do have a University Counseling Center webinar coming up. So Charles, Dr. Weddick, if you'd like to touch on this, feel free, but I am going to drop the registration link and the date and time for our University Counseling Center webinar in the chat in just a moment.
So we are co-located with the University Counseling Center. So we work really closely with them. We have a psychiatric team with a psychiatrist and a psychiatrist, but then in addition, pretty much all of us who do primary care, also that includes mental health care. So often a student will perhaps be seeing somebody at the counseling center, be struggling with maybe depression, anxiety, something along those lines. They'll come see one of us, and we do medication management, working with them, often in consultation with the counseling center folks. So that's kind of the whole behavioral health piece. It's a big part of what we do.
Thank you. And I did put that registration link for the University Counseling Center webinar on Monday, July 6th at noon, but it will be recorded and posted to that Student Affairs YouTube channel. So do not worry about missing it if you're not able to tune in live. Next question, do students need any particular documentation on file to carry their EpiPen or inhaler or any other medicine?
Nope.
Easiest answer you've both given. No. Wonderful.
Nope.
Next question. I think this one will be for Michelle. Does the pharmacy provide biologic injection for conditions like colitis or Crohn's?
That's a great question. It's selective and it depends on your insurance. We typically don't carry those medications because they're typically considered specialty meds and your insurance dictates specifically where you can get them filled. I would definitely welcome you to contact member services and find out if the biologic would be covered by your insurance at our particular pharmacy.
You cleared all of our questions again. But I don't want to cut anyone off because I got such great questions. Is there an urgent care that works 24/7 nearby?
So near the Oakland campus, there is not an urgent care, but there are, as Dr. Weddick pointed out, there are two UPMC facilities that have emergency rooms.
Because I think the urgent cares are they're not 24 hours. I mean, they're located a little bit further away, but they're not, most, other than ERs, most places are not 24 hours.
That's what I was thinking about, the one again, Shady Side, but it
closes
at like 9 p.m. I think.
Yeah.
So yes, definitely not an emergency room for 20. Other questions? I can see some of our attendees are starting to drop off, so hopefully that means they got all of the great information they needed. And just a reminder, we're available, both Student Health Services, the Office of Parent and Family Resources. We are completely dedicated to making sure that you have the resources you need to support your student. And so if questions come up, after you've thought about this or you're eating dinner together and chatting about what you learned tonight, please reach out to us. This is not a one and done. This is the start of the conversation because there's so much good information to get to you. Here it will be posted to the Pitt Student Affairs YouTube channel in just a day or two. We'll get that up there. But as always, we're here. Reach out to us via email, phone call, stop and see offices when you're on campus with your student. And we can't wait to see you in August for arrival. Thank you, Charles, Dr. Weddick, Michelle, Dr. Greenwald. Thank you.
Thank you.
Thank
Thank
you.
you.